There are many different forms of vertigo, and vestibular-cochlear nerve compression is generally the cause. Um, there is a case of where you can get an infection in the inner ear, and the organ, the vestibule, which controls or gives the signal of your position and movement to your brain, can get compressed from the inside by an infection. That's not as common now as compression of the nerve that takes that signal of your position and movement, and also the signal from the cochlea, which is your sound organ, which can also be affected by an infection. But the signal from those organs comes through the vestibulocochlear nerve, which actually comes out of the skull and goes back in the skull through the foramen magnum with the spinal cord. And in that passage, it travels between the skull and the top vertebra, which is called the atlas. So between the atlas and the occipital bone, which is the bottom bone of the skull. The atlas is shaped kind of like a plane or like a bird, and it has wings. And if it tilts, the wing on the left or the right will will be pulled down by muscles below it, and the other side of the plane, the wing will push up into the vestibulocochlear nerve. So this is the cause of vestibular-cochlear nerve compression generally. It's there's not really too many other ways that it can get compressed. So how does this happen? It's caused by the semispinalis muscles. There's a semispinalis capitis and the semispinalis cervicis, and through empirical experience, through thousands of hours of trying this and working with people that have had vertigo and hearing loss, mostly vertigo, these two muscles seem to be the muscles that always cause that tilt of the atlas. And by releasing them, it's about 100% for being able to release vertigo unless they have an infection in their inner ear, which most people would already know about if they've had any medical help. And this is the way to fix it when general medicine fails people. So all you have to do is release the semispinalis muscles, and this video is all about that, so let me show you. The semispinalis capitis muscle emerges from the posterior surface of the upper thoracic and cervical vertebra, and it inserts onto the occipital bone. Its job is basically to extend the head and extend the neck by extending the head back when it contracts. To stretch it, you just have to flex the head a little bit, and you can also just directly traction it. So I'm going to show you a technique here where I'm tractioning the head and I'm pressing straight into the semispinalis capitis muscle. And there's a note about this muscle. It can cause vertigo, or it can be involved with vertigo. The nerve called the vestibulocochlear nerve travels from the inner ear into the foramen magnum with the spinal cord. I know it sounds like a lot of technical stuff, but basically the nerve that carries the signal of both sound for hearing and balance travels between the first cervical vertebra and the head. So this muscle, it can pull the head, it can tilt the head to the left or to the right. And the next muscle I'm going to show you is the semispinalis cervicis, which can rotate the first vertebra to the left or to the right. And if that nerve gets trapped in between, then you can lose your hearing. One can lose their hearing, or they can have vertigo. But in this prone version, I'm tractioning the head with the hand that's also kind of pressing into the back of the head with my fingertip and pressing straight in with my other fingertip with the other hand. So let me show you the semispinalis cervicis. Semispinalis cervicis is use a similar technique, both the supine position like this and also prone. So in the supine position, you're using one hand cradling the head. The other hand is making a ridge with your fingertips, as I'm showing here, and lifting into the cervical vertebra. So by lifting the head and then actually dropping the head, not dropping it, but slowly lowering it back down onto your fingertips, you can apply a lot of pressure. You get the releases on both of these muscles, and you will, I've actually had clients have their hearing come back, and vertigo almost always goes away when you get both of these muscles to release, so good one to know. This is the semispinalis cervicis from the back, and kind of the same thing. See, I'm stretching the head and the vertebra actually with one hand, and pushing into the pressure points of the semispinalis cervicis with the finger of the other hand. And I actually go kind of like shoestrings on a shoe. You feel it traversing. So You get the releases on both of these muscles, and you will. I've actually had clients have their hearing come back, and vertigo almost always goes away when you get both of these muscles to release. So, good one to know. Okay, let's go into the spinal muscles next. The spinal muscles, there are several of them, and most of them are actually in the torso section. But I want to show you this longissimus cervicis release because the longissimus starts pretty far down in the back, and it goes all the way up to the neck. But you really have to release it right here, kind of at the apex of the thorax, see between the shoulder blades. And what I'm doing with the other hand is I'm tractioning the spine. So I'm using the sacrum as a way to kind of just traction the whole entire spine, pulling it tight. And with the upper hand, I'm pressing into the longissimus thoracis muscle, or longissimus cervicis muscle, and catching the spinalis cervicis a little bit also, but it's mostly pressing straight into the longissimus cervicis. So it's a long muscle that attaches to the back of the neck, and it will cause neck pain if it's tight. So we have to include it in this section. Go ahead and watch a little bit, and this is definitely a good one to practice. You can use this same kind of mechanics with any of the spinal muscles, by the way. This is a vertigo, the only way to fix it. So learning how to do these techniques can really be a godsend. Might as well practice them and get it down. And if you can find somebody with vertigo, go ahead and try it. Practice the release techniques from the videos and make sure that you go over the memorization exercises so you know exactly where the semispinalis muscles are and where the other spinal muscles of the neck are that could be involved. So anyway, enjoy learning and good luck.